Good morning and happy 211 Day. Thank you so much for the folks that are here with us in the room today, and thank you to everyone who's tuning into our live stream across West Virginia. I'm Brett White. I am the CEO of the Tygart Valley United Way, and I have the privilege of serving as the chair of our West Virginia State Collaborative. Our collaborative is made up of 13 United Ways across West Virginia. Just 4 years ago, we set out on this unknown path. Prior to that, our United Ways, although doing amazing work, had no collaboration on projects statewide. We knew that to better serve our state, we needed to come together to work on issues facing all West Virginians. We set out on that journey with two significant goals in mind. First was to bring 211 back into the United Way family and build it into West Virginia's trusted information line. And you're going to hear from Margaret in just a few minutes and about the amazing year that 211 had. We'll check that off the list. The second was to bring the Alice Report to West Virginia. Well, today, we're thrilled to check that second goal off of our list. And with that, our new website, unitedwaywv.org, is now live, and you can go and view the Alice Report and follow along with the data. West Virginia, we want to introduce you to Alice. Alice is our neighbor who works hard and still can't make ends meet. They are asset limited, income constrained, employed. They are Alice. I'm going to let my colleagues share the data with you, but we are so excited about this opportunity to bring this information to our state. We published this report today from a hopeful and optimistic place. Yes, there is certainly work for us to do in West Virginia, but we hope this report becomes a tool for organizations, elected officials, and problem solvers around our state to use when finding solutions to build a better West Virginia. The data in this report belongs to all of us. After meeting Alice today, we hope that you will join us and become united for Alice, because United Ways around the state are going to be evolving our community work to fight for Alice every single day. We hope that other organizations will follow our lead. This report, as you will hear, is part of a national United for Alice movement. In my role as chair, I've had the pleasure of working with the United for Alice staff. Molly, Catherine, Stephanie, Christina, and their entire team have been so helpful to us through this entire process, and we can't thank them enough. The report wouldn't be possible without the generous financial support and sponsorship of the Claude Worthington Benedum Foundation. Their generosity and care around our state is unmatched. We'd also like to thank our Research Advisory Council. These extremely talented and respected individuals spent the last year helping us develop this report and providing local guidance. They are Dr. Joy Buck from the WVU Medicine Eastern Division, Monica Delamay from the West Virginia Department of Education, John Deskins from West Virginia University, Seth DiStefano from the West Virginia Center for Budget and Policy, Dr. Susan Gamble from the West Virginia Statewide After School Network, Craig Glover from Family Care Health Centers, Tiffany Holland Wright from the Federal Reserve of Richmond, Pamela Kaler from the Department of Health and Human Resources, Dr. Lynn O'Connell from the Marshall University School of Medicine, Dr. Ladada Taylor from the Adventure Group, and Beth Zarati from Catholic Charities West Virginia. Please join me in thanking this distinguished group of champions for their support this year. Now we're ready to learn more about Alice. So I'd like to take this opportunity to introduce Lara Lawson from the United Way of the River Cities.
Good morning. I'm Lara Lawson, Director of Community Impact at United Way of the River Cities. Our service area is Cabell, Lincoln, Mason, Wayne counties in West Virginia, and Lawrence County, Ohio. Unfortunately, our Executive Director, Carol Bailey, is very sorry to miss this important press conference as she's isolating due to COVID. Today, we'll be hearing about the Alice Project, an important initiative developed by United Way of Northern New Jersey. Since its beginnings, the project has grown and expanded to its current state. 675 local United Ways across 23 states are now involved with this compelling work. We are proud that today West Virginia becomes the 24th state to join in supporting efforts to give Alice the tools needed to achieve financial stability. Now I'd like to introduce Stephanie Hoops, who tell us more about the National ALICE project. Stephanie Hoops, PhD, is the National Director of United for ALICE, where she created the measures for asset-limited, income-constrained, employed ALICE households. Dr. Hoops has presented ALICE research at conferences and panels at the Federal Reserve, the Biden Institute, and most recently in testimony before the U.S. House Rules Committee, and her research has garnered both state and national media attention. Dr. Hoops has a PhD from the London School of Economics.
Hello, I'm Stephanie Hoops, National Director. It's been quite a year pulling together the data, working with local United Ways, your research advisory committee, and local stakeholders. We appreciate everyone's contribution, and I think you all are going to have a fantastic outcome. We thought it would be helpful as you launch and become more active in the project to learn a little bit about the roots as a way of understanding where we've come from and perhaps where we're going. So just over 10 years ago, we started in northern New Jersey, and like you, found the federal poverty level wasn't really telling us what was happening on the ground. And so digging into it further, I was a professor at Rutgers and brought my research tools to the case. We found that the cost of living in northern New Jersey was well above what the federal poverty guidelines reported. And then we looked at how many households earned below that and found, lo and behold, it was almost double the number reported in poverty. So we wrote that up. We coined the term ALICE, Asset Limited, Income Constrained, Employed, and shared it out with our community. We found that over the next 2 years, all kinds of people were using it, and it was time to update the data. So we updated it for the whole state of New Jersey and found that there was big variation county to county, not only in the cost of living, but also what wages paid. And so that finding helped pull the state together and understand more what was happening on a state level. And with that success, we started sharing out with neighboring states, and we grew from 1 state to 6 states to 10 states, and now up to 24 states with West Virginia. And we've also produced the data for every county in the country. So we are a national project. And the findings have some level of consistency. Everywhere we have found ALICE families, young and old, all different race and ethnicities, all different genders, all different household combinations. And with that, it's been really important to dispel myths about what people's notions are of who's struggling, and even the way we use the term poverty. So those findings are really important. And then the differences are really important too. Some states have a very low cost of living, others have a very high cost of living. It's important to recognize that. All different kinds of industries, job combinations, from tourism and healthcare and education, manufacturing, that composition always matters. And the history of what's happening in a state makes a difference. So we are work really hard to pull that out in our state reports. And I think that you'll find in West Virginia that we're able to recognize the different regions across the state, the very different costs of living, different focus of industry, coal mining in some areas, much more diversification in other areas. But overall, with 45% of households below the ALICE threshold in West Virginia, it's one of the highest rates in the country. So I'm sure that doesn't surprise many of you, but I think you'll find it useful to have that data to get behind the stories that you already know too well. So a couple of things about the project. We have 2 guiding principles. One is that we want the data to be useful. This isn't just an academic exercise. We want it for folks on the ground to be able to use policy, to use the data to inform policy and have better outcomes, make a difference for Alice. So we look forward to hearing back from you, feedback about what it is that you need, what's useful, and the project is always evolving and improving. And the second part of our guiding principles follows directly from that we are collaborative and we like to work together with our local United Ways, our state leads, and community partners across the country. We also hope you will be collaborative. West Virginia is smack dab in the middle of several partner states, and we hope that you will work with Ohio, Pennsylvania, Maryland, and Virginia. And I think together you can not only make a difference at the state level, but you may be able to move some federal policy as well. And then I wanted to remind you that Alice is not just a report. You are getting a fantastic website with all kinds of data dashboards, maps, graphs, and tables, spreadsheets, downloadable fact sheets and reports. So please dig into that, unitedforalice.org. A lot of resources there for you. And then we have things coming throughout the year. So we're excited about the Alice Focus series, Alice in Focus. First, we'll dig into Alice Children, and that will be released in April. Next, the focus will be on people with disabilities, released in July. And third, Alice focus on Alice veterans, and that will be released in November. So some deep dives on some important groups is coming your way. We also have a learning community where United Ways from across the country share best practices, initiatives, things they've tried that have worked, and things that haven't worked so well. So we hope that you will participate in those. The next one coming up is on Alice Chambers of Commerce using Alice data, and followed by the ways Alice data has been used in advocacy at the state level. So look forward to those. And then lastly, we are in the initial stages of planning and hopefully an in-person Alice Summit in 2023, when you'll have a chance to get together with some of your colleagues from across the country and hear the way the Alice data has been used in all kinds of different ways by different stakeholders. So lots more to come. You all are at the beginning. It's very exciting, and we're just once again delighted to welcome you to United for Alice.
I would like to introduce Brandy Helms, Chief Executive Officer of the United Way of Monongalia and Preston Counties.
Stephanie was able to provide us a lot of background about Alice, and we're going to move into talking a little bit about Alice in West Virginia. In addition to the 124,000 West Virginia households that were in poverty in 2019, another 203,547 were Alice, asset limited, income constrained, employed. These households earned more than the official U.S. poverty level, but less than what it costs to survive. Combined, Alice households and households in poverty fell below the Alice threshold, the average income needed to survive in today's economy. To put these numbers in perspective, 45% of West Virginia households were unable to afford the essentials needed to survive in 2019, up from 38% in 2007. Alice workers were locked out by the post-recession economic boom due to stagnant wages and rising cost of 6 essentials: housing, childcare, food, transportation, healthcare, and a basic smartphone plan, outpacing inflation. According to the Alice Essentials Index, a measure that assesses the cost of household essentials over time, the cost of these basics rose at an average rate of 3.4% annually nationwide over the past decade. That's in contrast to with an annual rate of inflation of 1.8%. The basic cost of living in West Virginia was well below the federal poverty level, ranging from $22,296 for a single adult to $24,984 for a single senior, to $61,908 for a family of four with an infant and a preschooler in 2019. Meanwhile, the occupation projected to have the largest number of new jobs in West Virginia, fast food and counter workers, earned a median wage of $9.70 an hour, less than what's needed for all of those budgets. At this time, I'm going to introduce Stacy DeSico. She's the Executive Director of the United Way Alliance of the Mid-Ohio Valley, and Stacy's going to give you a little bit more information about our work with ALICE.
For the tall people. I'm so excited to be able to have a few moments and share with you what your United Ways are already doing to serve ALICE in the state of West Virginia. Your United Ways have worked since the very start of the pandemic and established COVID-19 recovery funds that distributed more than $1 million across our state, many of those dollars going to ALICE. Many of those dollars were immediate and responsive programs, and many of those dollars are still at play dealing with the sustainable issues as a result of the pandemic. Your United Ways are leading conversations and coalitions that raise awareness and take action to address the growing ranks of ALICE households in West Virginia. We're working to lift the economic well-being of ALICE and all residents in West Virginia. We're shedding light on systemic and underlying factors that keep ALICE from being successful. Your United Ways are already working in short, medium, and long-term solutions for ALICE, and some of those include every year $9 million in United Way funds are raised and distributed to build stronger communities across West Virginia. $9 million goes a very long way in this state, and that's the collective impact of your United Ways. Those investments are in the areas of education, health, financial stability, and those dollars are supporting ALICE all across our great state. Your United Way, as Brett shared, has worked so hard to establish West Virginia 211 as the trusted and official information and referral hotline for our state. Last year alone, 31,000 211 calls for assistance were answered by our call specialists. We know there's not one silver bullet solution. We don't think there's a magic strategy for all ALICE households. But what we do know is that through this ALICE research that we've provided, we've given a nonpartisan tool that can be used by business, by government, by nonprofits, by the faith-based community, and by the residents of West Virginia. Using this data, we can work together to improve conditions for ALICE and for our community at large, for all of the citizens of West Virginia. I'm so excited to be a part of this work, and I'm so proud of what we're doing in this state. And I have the very distinct honor of introducing my friend and my colleague and a leader in this state for us, Margaret O'Neill, who is the president and CEO of the United Way of Central West Virginia and is also serving as the president of our West Virginia 211.
I'm not quite as short. Good morning and welcome to our ALICE launch and also West Virginia 211 Day. We always laugh because people go, how do you know it's 211 Day? And it's like February 11th every year. You can put it on your calendar and you'll remember next year. So I am Margaret O'Neill. It's my pleasure to serve as the president of United Way of Central West Virginia. Our United Way covers 6 counties, Kanawha, Putnam, Boone, Logan, Clay, and Braxton, in the center, the very heart of our state. We are so excited about our ALICE launch and the connection that ALICE has to 211. So it's my pleasure today to share a little bit about what's happened to West Virginia 211 over the last 3 years and our excitement about West Virginia 211 in the future. So we were just having a conversation here in the room, so thanks to you are here. We have a couple members of the RAC, Craig Glover from Family Care, member of our board of directors, our other United Ways and guests, and those of you who are watching virtually, we certainly appreciate that this morning. The first thing we want to talk about is our thank you to the Claude Worthington Benedum Foundation. The Benedum Foundation not only provided support for us to bring ALICE to West Virginia, but the Benedum Foundation allowed us to save West Virginia 211. So our heartfelt thanks are not not insincere, but so genuine, to Kim Tiemann, who is our program officer, and Jen Giannavetti, I'll never get her name right, who is the president of Benedum, and we are so thankful for their partnership and, frankly, their trust that we would do what we said we would do when we wrote the application. So thank you, Kim, and thank you, Benedum, for your support and trust of West Virginia 211 and your United Ways in West Virginia. Absolutely. Couldn't have done it without them. That support also included the Greater Kanawha Valley Foundation, who trusted again that we would be able to pull off our work. Other funders, every United Way in West Virginia supported this project, as well as some other money that we received through COVID. So the most important thing about funding I'll talk about at the end. I want to give you just a brief history as you look at the numbers from our annual 2021 report. West Virginia 211 became West Virginia's information and referral number in the early 2000s. Since then, it has been governed by a different variety of boards. In 2018, the United Ways of West Virginia were approached about the possibility of our taking over governance of 211, and we were very excited about the opportunity. United Ways were at the table in Washington, D.C. in the early 2000s when 211 was created, and it is a United Way program and project across the country. So ironically, in March of 2019, March the 12th to be exact, West Virginia 211, under the governance of the United Ways of West Virginia and our brand new partner, First Choice, answered our very first call. And we could not have been more excited, and we were also sure that we would have some time to work out the kinks and bugs and be able to provide the absolute best service we could to the citizens of West Virginia. And lo and behold, almost exactly a year later, a COVID pandemic hit our country. And 211 saw an immediate increase of a little over 400%. Operators across West Virginia were stood up in addition to what we already had, other folks that could help those operators, and lots of time spent reassuring that we knew the services were available, checking to make sure food pantries were still open, checking our resources, making sure that our operators had the absolute best information to give out to the citizens of West Virginia as they made those phone calls. We thought we would never see as many calls as we saw in 2020, but I can promise you that what you see today is more than what we received. 2021 saw us answering over 31,000 calls in West Virginia statewide. Now, I want you to think about that for just a minute. Those are people. So those are numbers and those are data, and we use the data a lot, but those 31,442 calls were people. Somebody who needed assistance, somebody who was hungry, somebody who for the first time may have found themselves under an eviction notice, somebody who lost their electricity and their water and had children in their home, people who had found themselves homeless for the very first time in their whole life. And our operators, our experienced, trained operators across the state were the ones who answered those calls, often heard the tears on the other end of the line. Babies crying because somebody was standing outside telling mommy you had to leave your house. Children who were going to school with dirty clothes and dirty hair because they didn't have water. And mommy calling a 211 operator begging for help. So those numbers are people. And I couldn't be prouder of the operators across our 13 United Ways who every single day make an exceptional effort to find the resources those callers need. So if you have gratitude for somebody in 211 land, please have it for the operators and have a hand for them this morning for what they do. They are indeed special people, and we welcome anybody who has an interest in being a 211 operator to reach out to us, and we'd love to have a conversation with you about that. So here we find ourselves in 2021. I won't read the numbers to you. You at home watching or in your business can also see those. You can see our searches have gone up drastically. So some providers, we work closely with healthcare providers across the state, can use the search feature at wv211.org and access that themselves. Texts have slowed down a little in 2021, but you can still see we're almost 27,000 texts. And then our chats happen on the website. So if you search and you have trouble finding exactly what you're looking for, there's a chat feature there and an operator will reach out to you and do their best to offer assistance. The other thing we found really interesting are what those callers were asking for. So in 2020, without a doubt, the top 3 requests were utility assistance, food was number 1 across the board in 2020. food assistance, utility assistance, and rental assistance. And you can see we've seen a little change in that. We think there's a couple of reasons. There was some influx in funding to families mid-year last year for food assistance, so we think we saw that reflected in our callers for 211. Utility and rental assistance clearly still an issue, and we'll talk a little bit about our partner in that in just a second. But I want to point out that we've never seen homelessness reach up into our calls like we did in 2021. So if you wonder if it's true that people are experiencing homelessness for the first time, or maybe don't have an idea about where to reach out for assistance or service in that field, I can tell you that our 211 operators have heard that, and we can show that by our data. And then, still questions about COVID. So we try to make sure our operators know where you can get tests, where you can get vaccines, and where you can get health care support if you do test positive. The thing I want to talk about next, just really quickly, are the partnerships that have bloomed over the last couple of years. And so we were excited that our wonderful Governor Justice chose to make sure people in West Virginia knew about 211 early on in the pandemic. So in his daily briefings, he would remind people. We saw a slide, and that was one of the wins through this really challenging last 2 years, is that people really did understand they had a number to call. And those partnerships developed within the state. So we worked with Chelsea Ruby from the Tourism Department mid-year in 2020 to make sure, in 2020 and 21 also, to make sure that there was a feeding map available for children across the state to be able to access that data. We're still currently in a wonderful partnership with the Mountaineer Rental Assistance Program through the West Virginia Housing Development Authority to make sure that we can connect our 211 callers to MRAP, that if they need utility assistance or rental assistance, that they can reach out to MRAP. And our callers have screened folks, and so they don't waste time or get put into that proverbial, I'm just calling, around and around and around again. We try to really avoid that. We are excited about our partnership with First Choice. They continue to be a great partner. They answer the calls for us on evenings, weekends, and holidays, and our thanks to Lotta Manon and her team at First Choice for being a great partner. And then I also want to mention briefly WVU Medicine. So this is where we're going to just start to wrap up, but really want to give you a little vision about how exciting the future is for West Virginia 211. So we are advertising currently for our very first full-time executive director for West Virginia 211. I couldn't be more excited about that, but the growth that this organization will go through when we have a permanent full-time person in place. The people you see in this room have been doing this on a very part-time basis when we have full-time jobs at the United Way. So we're very excited to have someone who can focus and really dedicate their energy to the growth of West Virginia 211. Through that, West Virginia WVU Medicine, WVU Healthcare, has been working with us through 211 on a pilot project. And so if we are able to really work this out through the WVU system, their physicians and healthcare providers will be able to access our 211 data to provide immediate assistance to their patients. And so if we can make that happen with WVU, we're pretty certain we can make that happen with other healthcare providers and really allow the social determinants of health to be touched immediately from the healthcare provider's office, and that they would know exactly where they can go for food assistance or other things that may affect their health. So be tuned for that, because it's really going to be an exciting piece of work that we do with West Virginia 211. So I think that I have covered most of the bases. I just want to go back again and say thank you. We do have folks here in the room from Senator Manchin's office and Senator Capito's office, and I can tell you that from the very beginning, all of our government officials in West Virginia have been supportive of this work. We know that they work with us and send some of their constituents our way if we can help solve problems or challenges that they face. And so we're extremely grateful to the mayors, county commissions, and elected officials across the state who support not only 211, but your local United Way, who makes a significant impact every day. And so the last thing I'll say is to kind of tie this together to Alice. When those people were calling, and you saw those numbers, those 40-some or 31,000 people calling, many of them were Alice households. Many of them were taking the money they had in their hand to pay their power bill, but trying to figure out if they could get a box of food to extend their budget. Those are the people we help and serve every single day. So the connection to Alice is real and true, and for the first time, I think we have a real focus on how we can not only support them daily, but how we can work together as a community and a state to push them out of the Alice households into middle-class lives where they can take care of their children and families and not have to worry about how they're going to get a box of food. So as we wrap up today, again, we want to say thank you to the members of the RAC, certainly to Benedum, the Greater Kanawha Valley Foundation, and other funders who made 211 possible. We will do this. Oh, and I promised you that last tidbit. So some people count how many times I say the last time. This is the last thing I'm going to say. If you're doing that, we'll have a quiz on that later. But I forgot to mention one of the most important things. So the sustainability of 211 really was dependent on a funder. And although these wonderful foundations supported us, we knew that wasn't long-term sustainability. And what we needed to do as an organization is prove our worth, if you will, to the state of West Virginia and to show them again that we would be a valued partner in the work that they do. And I'm happy to say that we were able to make that happen. And so DHHR and our folks, Janie Cole and Jeremiah Samples and some others at DHHR did see the value in this work, and we have been granted a budget from the state, and we have sustainability for 211, and that 211 director coming in is going to have a real solid footing to move this organization forward. So we're extremely grateful to the state and to all of our partners. For those of you here, we welcome you to stay for a little bit. We have some information here that you can take with you. For those watching, please reach out to your local United Way and have those conversations about ways we can help you meet the needs of Alice families and other ways that we may be able to fill gaps in service that you see in your community. So our heartfelt thanks to all of you. Appreciate your being with us today, and have a wonderful, safe, and happy 211 Day.